So I'm going to be showing you how to do hot pack application today. The goal of using the hot pack is in order to provide a superficial heating to the tissue, and you want to get in that range of 104 to 110 because that is the therapeutic tissue temperature rise, and that's going to make sure that the therapeutic effect is happening, but also make sure that the patient is not getting burned. Hot pack application is indicated when the goal is to promote tissue healing, if you want to increase vasodilation to the superficial vessels, decrease pain perception, if you want to decrease muscle tone, and then if you want to try to increase tissue extensibility. Normally the hot pack application is going to be happening in the maturation phase, again just to get that tissue healing and increasing the range of motion. You can use it in the proliferation phase as long as you're not seeing any signs of inflammation on the patient, because that would just at that point make it worse. So we want to avoid that. There are a few contraindications and precautions to be aware of. There's actually a pretty extensive list. You want to make sure the patient doesn't have any circulation issues, don't have any decreased sensation, don't have any bleeding issues, so like a hemophilia type thing. Make sure they're not in that acute phase of healing. If they haven't been on any long-term corticosteroids, make sure they don't have any malignant cancer or have a current fever. Also, you don't want to apply it for women who are pregnant, and you want to make sure that, like I said, they have to be able to have the sensation, so it might not be best for someone who is older, and you also want to make sure that the patient's able to communicate and tell you what they're feeling, so making sure it's not a young kid who doesn't necessarily know what he or she should be feeling. So after you have cleared the patient for any contraindications, you've made sure that you've inspected the skin, and you have ensured that they have intact sensation, you can start to position the patient in the appropriate position for the application of the hot pack. So in this specific case, I'm going to have my patient positioned with her internal rotators on stretch, so in a relative position of external rotation. So if you want to go ahead and put your arm up like this. Now this is going to be specifically targeting kind of that pec major area. So I'm going to have her in this position, and the hot pack will essentially be applied over top of the pec major. In doing this, I am able to help increase the tissue extensibility of those internal rotators. So before I actually put this on the patient, I'm going to ensure that the hydroculator was in the range of 160 to 165 degrees Fahrenheit, so that the hot pack is appropriately heated. Again, remembering that it needs to be heated for 2 hours initially and then half hour between each patient. I will wrap the hot pack in 6 to 8 layers of dry toweling, and in this case the hot pack is inside of this 6 layers on each side. And then I'm going to apply the hot pack in this situation for 15 minutes prior to the treatment session, just to kind of increase that tissue extensibility. So, and decrease pain perception. It will also help with that. So now I'm just going to place this over top of here. And obviously in the clinic, the hot pack would be a little bit better size, but this is what we got. So, and again, this will be 15 minutes, and I will check and make sure that Sam is doing okay every 5 minutes during the session, and just making sure that there's no mottling of the skin or any excessive redness or any burns that are happening. And Sam, so what you should feel here is warm. Warm is good, but if it becomes too hot, just let me know, because we don't want that to happen. And then obviously this is one way to do it, but a couple other options that you could do would be continuous ultrasound or continuous diathermy to that same area, and it will provide the same effects.